Hello, welcome to the Foot and Ankle Surgical Associates Surgical Assistant Training video. This video will walk you through each step of your duties as a surgical assistant in the Foot and Ankle Surgical Associate Ambulatory Surgery Center, or ASC. The purpose of our ASC is to perform outpatient podiatric surgical procedures. It is then the duty of all the staff working in the surgical center to ensure each patient receives the most excellent service and sterile service before, during, and after the procedure. As the surgical assistant, you play a crucial role in ensuring each procedure is completed in a sterile, safe, and timely manner. Over the next several sections, you will receive the instruction and training necessary to begin your duties as a Foot and Ankle Surgical Associates surgical assistant.
Our surgery center houses a number of rooms, all of which serve a special purpose. This allows the surgical center to maintain a proper flow of patient check-in and discharge. As can be seen with the schematic shown here, a total of 4 main areas make up the surgical center. After patients check in at our front desk, they are directed to the area 1, the waiting room. This area is designed for surgical patients and their families to wait before and during the procedure.
Patient families may be allowed to be with the patient during their preoperative preparation if the registered nurse running pre- and post-op allows. You will not need to worry about any of the preoperative instructions or preparation on the day of the surgery. The registered nurse will take care of both that and the post-operative instructions. You must, however, be aware that any questions regarding patient involvement and family involvement must be directed to the registered nurse. You are there to assist the registered nurse in anything she needs help with.
The patient will move from the waiting room, area 2. This area houses both a preoperative and postoperative room. The registered nurse on duty will be responsible for this and may require assistance from you. The nurse will place an IV as well as mark and help prepare the surgical site for the procedure. The physician will then enter the room and brief the patient one more time prior to the procedure. The anesthesiologist will also enter the room and speak with the patient. They'll take care of any final paperwork before beginning the procedure. When both the patient is prepared and the OR is ready, the patient will be escorted to the room known as 3, the operating room, by you or the RN, at which time care will become the responsibility of the surgical assistants. As the patient is received, they will be instructed to sit and then lay on the operating table to finish being prepped for surgery. When the procedure is complete, the patient will be escorted back to Area 2 and placed in the post-operative room. It is here where the patient and family will be instructed on the use of special equipment and reiterated on their post-operative instructions by the RN. When done correctly, the patient's surgical day can be stress-free, easy, and efficient. The other areas shown here are areas that are specific for you and your job. Area 4 is the scrub sink where you will prepare yourself to be gloved and gowned. And Area 5 is the clean and contaminated area, the nurse's station, where instruments and supplies are cleaned and prepared for a case. We will now begin your training with a tour of the operating room. This is where all surgical procedures will take place. When first entering the room, you'll notice an operating table. This table is a multifunctional table designed to place the patient in the position that is most safe, accessible, and comfortable for the physicians, patient, and you. The pedals that allow for movement are located on the floor next to the base of the table and can be operated by pressing the buttons with your feet. Above the OR table, you will see a set of surgical lights. They are on during surgery, but they are to be off between cases. The switch to do so is located on the wall to the left, just inside the door as you enter on the north wall. The switch on the right turns on the lights for the surgeon, and the switch on the light controls the lights for the room. The wall facing the door as you enter houses the anesthesia cart. This is the south wall. It is a metal toolbox that houses all medications and equipment used by the anesthesiologist. Adjacent to this cart, on the left, is the monitoring equipment that is used to monitor the vital signs, as well as oxygen tank and masks for the patient. This equipment will be used only by the anesthesiologist, and you will be in charge of cleaning them only. Following that wall, you will see another toolbox that serves as the equipment cart. Within this are housed instruments, equipment, and supplies used during surgery. The supply cart will be your responsibility to keep stocked and cleaned and prepared for surgery. All of your injectable medications and surgical instruments will be kept in this cart. Sitting to the left of this cart is the Fluoroscan or C-arm. It is a portable, real-time X-ray machine used by the physicians during surgery to ensure proper fixation has taken place. You will be responsible to have it turned on and prepared with a sterile drape for use during surgery. The east wall is full of drawers and cabinets, and is where the majority of supplies will be stored, such as wound dressing materials, saline, gowns, gloves, and any other miscellaneous supplies necessary for surgery. This section will be gone over in greater depth later. The right side of the counter houses the crash cart, a black suitcase that contains all necessary equipment and medications in case of a medical emergency or code. The physician will be charged with this equipment if it's ever used. Along with the crash cart is the AED, or automatic defibrillator, and is used in case of cardiac arrest or ventricular fibrillation. Again, the use of this equipment will be directed by the physicians. It is important, however, you know where it's located and what it is called. All of the boxes are sealed, but outdates must be checked. So each month, the seal must be broken, inventory must be taken, proper outdates must be replaced, and then a seal must be replaced. As part of the operating room on the right side of the north wall is an outlet that leads to the nurse's station. This is where all instruments that have been cleaned and prepared are sterilized using the steam autoclaves housed in. These techniques are explained in detail in the back office assisting training video under the sterilization section. It is important to note that use of this sterilization room is prohibited during surgical cases. It is considered a clean site, so any material that need to be cleaned and sterilized must be taken through the dirty section.
In case of any medical emergency, there must be a way to communicate with the front office receptionist. It is for this reason that the receptionist will have a radio, as well as a circulator in the surgical case. They will communicate via channel 13, and this will only be used in cases of emergency.
We will now turn our attention to the specific supplies found within the operating room. All of the items necessary for a surgery day are found within the operating room on the east wall in the drawers and cabinets. Each drawer and cabinet is labeled, showing the contents found within. The 4 cabinets on the far right contain all of your sterile surgical gloves, saline, iodine, and endoscopy equipment, the pulse lavage, and endoscopy blades. The remaining 6 cabinets, continuing left, contain all the extremity packs used for sterile field and draping. There are different packs for different procedures. All of the normal foot and ankle cases will use the pre-made fields found in the 2 cabinets following the endoscopy equipment, while ankle arthroscopy cases will need arthroscopy packs found in the farthest left cabinets. The 2 remaining cabinets in the middle will house the EPF packs. They contain less equipment in them, and they're used specifically for plantar fascial releases. The counter is to remain clear and free of clutter. The only items that should be on this counter are the sharps container, same day pre-drawn injectables that you draw the morning of the surgeries, and cortisone for that day's surgical cases as well. Nitrile gloves, hand sanitizer, the crash kit on the far right, AED, and surgery center manuals and logbooks housed with the crash kit. The drawers below will house the remainder of the materials and supplies used during each surgical case. There are 5 columns of drawers, beginning left to right. The first column houses the arthroscopy tubing, demonstration extremity packs, and ice pads, to be used with the ice machines post-operatively. Column 2 contains sterile Q-tips, sterile sleeves for the Fluoroscan or C-arm, extra large chucks to place on the floor during each case, and the bottom drawer contains miscellaneous extra power cords for the equipment. Column 3 contains seals for the crash cart. As mentioned before, the crash cart each month must be inventoried for out-of-date medications, and the seal must be replaced after it is taken off. The drawer also contains pillowcases, more large chucks to be placed at the foot of the operating table, and extra sterile gowns to be used by the surgical scrub. Column 4 contains S-Mark tourniquet bandages, DuraPrep, which is the skin prep we use on the patient's surgical site, Prevail, another type of skin prep, gauze sponges to be used during the surgical case as well as the bandaging, and Kerlex, which is a heavy-duty bandaging roll to be used when dressing the surgical site. The final column of drawers contains many of the supplies the anesthesiologist will use, such as nasal cannulas for oxygen and the nerve block supplies. Also contained within this drawer is the suction tubing and miscellaneous turnaround forms for the surgical center. The small extension of the operating room, located next to the nurse's station on the north wall of the operating room, is where the sterilization equipment is located. Within the drawers and cabinets are supplies used in the sterilization process. Sterilization paper and tape, as well as sterile indicators, are located in the drawers and cabinets below the autoclaves, while the cabinets above house all sterilization logs and spore test logs, as well as surgical scrubs. For education on the use of the autoclave, see the staff training video under the sterilization section. Along the south wall of the operating room is located the fluoroscan. This is a mobile X-ray unit used to ensure proper fixation has occurred in surgery. For detailed instructions on the use of this machine, see your trainer. Next to this is a surgical supply cart. This toolbox is where you will find all single wrapped instruments and smaller packs used in clinic. There are 6 wide drawers on the left and 6 narrow drawers on the right. Each drawer is marked with the specific equipment found within. We will now discuss the tools and supplies found within each drawer. We will begin with the wider drawers. Drawer 1 on the left, shown here, is where all the bone anchoring materials, sutures, K-wires, and twisted wire for bunion cases are kept. Drawer 2 houses the instruments that are wrapped in small kits or single instruments wrapped alone. This drawer contains suture removal kits consisting of a pickup and suture scissor, staple removers, single wrapped hemostats, which are locking clamps for stopping blood flow or holding things together, wire to make the twisted wire, suture needle drivers for placing sutures, surgical scissors of many different shapes, and the Jergens pinballs and removers to be placed at the end of the K-wire so as not to puncture anything or get caught when a K-wire is used for fixation. Drawer 3 contains more single wrapped instruments. You will find your curette, which is an instrument with 2 cup sharp ends for scooping up lesions, the rongeur, which is an instrument that looks like pliers with sharp cups at the end. It's used for taking pieces of bone and tissue from the surgical side. You will find a rasp, which is used to rough up the edges of bone, more hemostats, saw blades for the bone saws, and pliers for pulling K-wires and other things. You will also find the maglanomery metatarsal elevator. This is used to free the metatarsal bones from any tissue during surgery. Drawer 4 contains more instruments. Different types of retractors for retracting skin and tissue, nail nippers used primarily in clinic but also in surgery to cut nails away, tissue nippers, a small nipper used for debriding and cutting away tissue, and the standard nail packs for all nail procedures. Drawer 5 contains the Bovie tips used for electric cautery, osteotomes, as well as miscellaneous surgical equipment and screwdrivers. The final drawer contains all the equipment used during endoscopic plantar fascial releases, as well as the Tobaz equipment and miscellaneous supplies. Turning our attention to the right set of drawers, the first drawer on the right will contain all of your injectable medications, as well as alcohol swabs, needles, and syringes for use of them. Drawer 2 contains surgical dressings. It contains a Daptic, a non-stick bandage that will help the other bandages from adhering to the wound, and Steri-strips, tape-like strips used to enforce closure of the surgical wound. Drawer 3 contains more Steri-strips and miscellaneous dressing materials. Drawer 4 is where the 3.5 screw set and bits are placed. Drawer 5 contains extra 4x4s and clean bandaging for dressing a wound. Drawer 6 contains extra sterile gloves, ACE bandaging, Sclato joint implants, the Shannon burr used to make the hole for the implants, and other miscellaneous materials. On top of the supply cart is where the saw, drill, cautery, and arthroscopy power supply and controls are found. The air conditioning unit is located on the wall above the anesthesia cart and is controlled by a remote placed by the light switch on the north wall. This must be turned on for each surgery and shut down at the end of each day. This helps us remain a negative pressure within the room. The nurse's station is located adjacent to the operating room. This is where you will scrub and prepare instruments to be sterilized. It is important to realize as you enter that there is a specific dirty and clean countertop. You may not enter through the operating room through the clean area. You must enter dirty room through the nurse's station on the dirty side. When a surgical procedure is complete, instruments are transported safely out of the front door into the dirty counter of the nurse's station, where they will be soaked, scrubbed, and rinsed. They are then to be placed on the clean counter to be packaged and prepared for sterilization. All injectable medications should be drawn and prepared on the clean counter only. The cabinet above the clean counter on the east wall is where all of the surgical supplies are stored, such as needles, syringes, sharps containers, and biohazard, as well as the injectable medication and anesthetics. If you need to collect a culture or tissue sample, all of the paperwork and specimen jars are stored in the nurse's station on the far right drawer of the dirty counter.
You will not need to worry about any of the supplies in the pre- and post-operative rooms. This is taken care of by the nurse on duty. The only exception is the ice coolers located in the room. They need to be cleaned and checked 1 week before use in surgery. This is to be done by the back office assistants. You are in charge of making sure this is completed.
Located in the hallway between the operating room and the pre- and post-operative rooms is the surgical scrub sink. This is where you will do your 5 and 3-minute surgical scrubs before surgery cases. Located in the cabinets over the sink are the surgical caps, masks, and shoe covers. Take some time to familiarize yourself with the surroundings in the surgical center, and do not hesitate to direct any questions or concerns you may have toward your trainer or the physicians. We're here to help and want you to succeed in your duties as a Foot and Ankle Surgical Associates surgical assistant. On the days you are scheduled to assist in surgery, you will want to arrive to the clinic 1 hour before the first case is scheduled. Though much of the preparation for surgery has taken place before this day, such as sterilization of instruments and ordering of supplies, it will be your job to check that everything is still ready and prepared. By arriving an hour before your first patient, you are given the necessary time to prepare whatever may have been missed. You will begin by turning on the lights and unlocking the doors for the nurse and patients to enter and prepare. Within the surgical center, there are 2 main assisting duties, that of the scrub technician, or scrub, and the circulation technician, or circulator. The duties of each individual position will be explained later, but realize that this is the time you will do your opening procedures. After arriving to the office and opening the office, you will need to change into the proper attire for a surgical day. Because we wish to remain clean and sterile as possible, each member of the surgical staff is required to wear surgical scrubs and shoe covers at all times while in the surgical suite, and to refrain from leaving the surgical suite as much as possible. When entering restricted, sterile areas past the red line, you will place a surgical cap over your head, covering all visible head and hair. You will also wear a surgical face mask. You will need to confine your jewelry or remove it, and you may not wear any artificial nails or polish when in restricted, sterile areas of the surgical suite. At any time you may be exposed to risk of contamination. You are to wear protective eyewear. Both the surgical assistant, scrub, and the circulator will need to look over the schedule of the day and prepare themselves mentally for the cases and order of them, so that you're able to prepare proper equipment and tools, as well as be aware of places within the schedule you may possibly get behind or catch up. You will want to take and make a quick inspection of the operating room to ensure that the surgical lights as well as all equipment are in proper working condition. Each assistant will then complete their own opening procedures in preparation for the surgical case.
We will now be discussing the duties of the individual assistants, both scrub and circulator. It is important to realize that one job cannot be completed without the other. The scrub must ready the room and clean the counters. Without this, the circulator could not prepare a sterile field. Without the prepping of the patient by the circulator, the scrub could not prepare the patient with sterile drapes for the surgeon. And without sterile instruments, the scrub is unable to assist the physician in the procedure. Both jobs are necessary for the flow of the surgical center, and they work in tandem, much like 2 dance partners. It is important that each assistant not only strives to perform efficiently and correctly, but to help their partner do the same. It is this attitude that will allow the surgical experience for each patient to be sterile, safe, efficient, and the best surgical experience ever.
The duty of the circulation assistant in the OR is to ensure all instruments, equipment, and supplies are prepared and ready for each case of the day, and to be prepared for anything the surgeon may need during the case. This job is probably the most important and difficult because this is where the buck stops. If the instruments, equipment, or supplies are not ready or available, the circulation assistant is responsible. Because equipment is very expensive, and the surgery center does many cases per surgical day, there are not enough full sets of instruments for each individual case. Instrument sets must be cleaned and re-sterilized in between cases. We use 3 main instrument sets. However, during a full surgery day, there could be anywhere from 8 to 13 surgical cases. This makes it necessary to have a circulation assistant to ensure each case has the instruments necessary. There must also be room available and instruments prepared to be replacements in case any individual instrument is accidentally contaminated during surgery. To accomplish this, the circulation assistant must make use of the sterilization equipment in a manner that will ensure each procedure has the instruments needed. The circulation assistant will need to set up each sterile field and instrument table. While the patient is in the preoperative room, you will be in charge of preparing the field. This, in essence, is the workstation of the surgical procedure. All instruments and supplies will be placed on this sterile field, and the surgeon and assistant scrub tech will be directly in charge of the maintenance of this field. Before this field is created, the surgical assistant circulator should double check any preference card and the schedule to be sure they know the procedure which is being prepared and ready all materials. They will need to ensure the room is clear of any furniture clutter. The furniture that will be draped in sterile fields should be placed in a group near each other. For instance, the OR table and C-arm for fixation type cases. These items and the field should be positioned in an open area furthest away from the OR door due to the fact that opening and shutting the door creates air current, stirring up particles and contaminants. All furniture, tables, and stands need to be positioned 12 to 18 inches away from any walls, and all non-sterile furniture and equipment. Understand main pattern for traffic for you and the surgeon, and ensure all non-sterile items are clear from this path. Be sure to position the OR lights directly over the patient's site of surgery, as well as the surgical area of the table for good visibility. Before opening the sterile field packaging, make sure all the furniture is placed in the position it will be utilized during the surgical procedure, including proper back table position and stand position, as well as equipment position. Inspect all sterile field and instrument packaging to ensure the sterile strip indicates proper sterilization and there is no evidence of strike-through. Confirm the expiration date if present. Do your best to establish a normal routine for opening instruments and fields so that the job is thorough yet efficient and remains sterile. A sample order is shown here. First, ensure you are properly dressed in surgical scrubs, mask, hat, and shoe covers. Start by opening the back table sterile field and extremity pack. To do so, tear the plastic along the dotted strip and place the folded pack in the middle of the back stand. The top fold, labeled 1, will be held to the rest by the white sticker with the dotted line and a center tab stating press here. You will position the pack so that arrow pointing to the sticker that states open to back of table is facing the back of the table. Press where the sticker indicates and pull fold 1 with the other hand. Throw fold 1 towards the back of the table. This will expose fold 2 located under fold 1. Without touching any of the dark blue areas of the package, you will place your fingers under fold 2, grip the edge of the fold with your thumb, and pull toward the U, allowing the material to fall to the front of the table. This will expose folds 3 and 4. Using the same procedure you used for fold 2, you'll grip underneath folds 3 and 4 and pull them to either side, dropping them to the sides of the table. This has now created your back table sterile field. This will form the sterile field in which you will build your instruments and your extremity pack and drape. We use different extremity packs depending on the procedure. For endoscopic plantar fascial releases, we will use the plain small extremity pack. It contains within it the back table cover, which you've just opened, a Mayo stand pack, which is used at the end of the procedure as the garbage bag, one suture bag with sticky tags to be placed on the side of the table to catch all of your garbage and suture material, 2 adhesive drape towels to be used around the patient's surgical site, 1 large plastic sheet to be placed on the OR table under the patient's prepped leg, and 1 absorbent extremity drape, which will be placed over the patient's prepped leg to sterilize all surfaces of the OR table and isolate only the leg we need to perform the procedure on. Most cases involving procedures of the foot and ankle will require the use of the pre-done extremity pack. This pack contains the same materials listed above for the EPF pack. However, it is pre-packaged with other materials such as a blade, bandaging material, gauze sponges, gloves, a gown, steri-strips, adaptic, and sterile solution. When doing an ankle arthroscopy, you will need to use the arthroscopy pack, which is a more intense pack. It houses more materials and different draping to be used during ankle stabilization cases. After you have opened your sterile field and the contents are sitting sterilely on the field, you will need to pass other instruments and materials to the field. This must be done using an aseptic technique which will keep things from being contaminated. It is important while in a surgical center to develop a watchdog personality. We are all working hard to ensure each item remains sterile. However, mistakes occur. Fields are contaminated, walls are bumped, and it is our job to watch for these things and call them out so we can replace the contaminated item with a sterile one. On the field, each case needs 3 main types of supplies. The first is the procedure prepping supplies. This includes the skin prep, sterile field, and the tourniquet to be placed over the foot or ankle. The next set of supplies needed are procedure supplies. This includes all the instruments, including power instruments and power cords, any injectable medications, and any screws, wires, or implant materials to be used during the procedure. The last set of supplies we need are the procedure bandaging supplies. This includes steri-strips, Adaptic, gauze sponges, cling, Kerlix, a Kool-Aid pad if used, and ACE bandages. This will also contain a post-operative shoe or boot that will be replaced after the sterile field has been broken. It is your duty as a surgical assistant to ensure all of these materials are placed on the sterile field prior to the patient entering the room and the procedure beginning. The physician may require other specific tools and materials, so you are to be prepared for anything the surgeon may require. When the sterile field is initially prepared, you will need to look and put the following items initially on the sterile field. You will need an S-mark bandage, a 10-pack of 4x4s or gauze sponges, 2 15 blades, Adaptic, 2 pairs of sterile gloves, a sterile 10cc syringe, 2 sterile gowns, Kerlix, steri-strips, and a Bovie cautery tip. You will then place the instruments necessary. When opening and passing materials to a sterile field, you will need to adhere to the aseptic technique. To do so, when opening the sterile pack, you will place both hands at the top portion of the peel pack and slowly and evenly peel the back both sides so as to open the inside sterile side of the flap out, and the understerile side will fold around your hands, covering them from the sterile material. You will then flick the material onto the sterile field, standing 12 to 18 inches away, as shown here. When the field has been set up and the required materials have been placed on the field, you will then need to retrieve the instrument kits from the autoclave or storage area in the closet of the OR. There are 2 types of cases of instruments. One case has a yellow top, the other a red top. The yellow-topped instrument cases are the subpar instruments. They are older and do not work as well. They may be used in cases of emergency but should not be used unless necessary. The red-topped cases are the newer, more effective tools that the surgeon and scrub assistants prefer. There is a special set marked Scope. This is the set that will be used specifically for ankle arthroscopy cases. You will now need to open the appropriate tool case for the procedure and place the instruments on the field. To do this, first, break the seal and remove the lid from the case. Be certain you do not touch anything within the case, as the tray and instruments are sterile. Next, you'll need to glove yourself with sterile gloves. To glove yourself with sterile gloves, you'll open a package of sterile surgical gloves that are your size. Take off the plastic cover and unfold the glove paper. You will then open the gloves, following the instructions of the tabs of the paper cover. Once the paper is completely open, showing the 2 gloves, you will begin by grabbing the glove of choice with the opposite hand to be gloved. You will grab the glove at the folded rim, making a closed C with the hand you will glove, and holding the glove at the folded rim with the opposite hand. You will work your hand into the glove, being careful to only touch the surface that will fold onto your wrist and arm. When one glove is on, you will reach down for the other glove with the sterile hand. This time, you will grab the glove at the glove cuff, placing your fingers under the cuff. Cup the ungloved hand and work your hand into the glove, being sure that the sterile hand does not touch the unsterile hand. You are now ready to lift the sterile instrument tray out of the case and place it on the sterile field. Be certain to stand at least 12 to 18 inches away, and only your sterile gloved hands are over the field. Place the instrument set down, and while gloved, you will now set up the sterile field for the surgeon and scrub assistant. Initially, all bandaging cloth items should go on the left side of the field, and all instruments to the right. You will set the saw and drill on the field and place the electrical cords on top of them. Place the sterile drape and surgeon and scrub gowns along with gloves. In the upper left corner, place the saline basin and 10cc syringe in it. You will also place all 3 saw blades next to the basin in the upper left corner. You will place the Adaptic and steri-strips to the bottom left corner, and just above that you will place the ACE wrap, Kerlix, and S-mark bandage. In the top right corner of the field, next to the electrical equipment, you will place the screw sets, screwdriver, and all the bits necessary for use in the drill. On the bottom right of the field, you will place the big jungle scissors with the bone forceps and towel clamp. You will now lay out instruments from left to right in 2 rows. Row 1 will have retractors, rongeur, needle driver, suture scissors, and bandaging scissors. Row 2 below it will have the blade holder with a 15 blade on it, pickups, dissection scissors, curette, freer, retractors, and all hemostats both straight and curved. Place the Alice clamps by the drill bits and place the extra blade holder by the wire cutters down on the right side of the lower part of the field. When the sterile field has been prepped, the patient will be escorted into the room by either the RN or scrub technician and placed on the table. You will need to make sure all shoes and socks are removed from the foot or feet to be operated on. The patient may choose to wear a sock on the other foot. That's fine. They will be in shorts or sweats. If they chose to wear sweatpants, you will need to roll up the leg completely past the knee. Check to make sure that the leg exposed is the correct leg for surgery. You should see an X or initials on the proper foot to be operated on. You will need to verbally confirm with the patient and the staff in the room using the chart that this is the correct foot or ankle. When confirmation has been obtained, you will then place a basin under the patient's calf if they are having a lower ankle or foot surgery, or in cases of upper ankle to calf surgery, you will need to have a second person available to hold the foot and leg in the air. This will be necessary to perform a sterile prep to the surgical site. When performing a surgical prep, you will need to follow these steps to ensure it's done correctly. You'll want to assess the operation site prior to preparation for lesions or any other factors compromising the skin and document them. Notify the physician if there is anything present that may compromise the procedure. Maintain patient privacy at all times during the prep. Per the physician's orders, you may need to shave all hair around the surgical site. You will wash the surgical site with an antimicrobial agent, being sure to use the proper agent depending on the site, skin condition, and patient sensitivity. To prep the skin, you will begin at the side of the incision and move toward the periphery. The sponge is discarded and a new sponge is used as the prep continues. Condition of skin should be considered in the amount of friction used. Care must be taken if the integrity of the skin is in question to prevent injury from occurring. The prep solution should be dry or gently patted dry prior to application of adhesive drapes so that the adhesive drapes may stay in place, and the possibility of fire, if laser electrocautery are used, is prevented. After prepping the patient, areas surrounding the surgical site should be checked for pooling of fluids. Chemical burns can occur if prepping solutions pool under the patient, tourniquet, or electrocautery dispersive pad. The type of solution and area of prep should be documented on the OR record. After the patient is prepped and a sterile field is placed, there will be a pause to do a timeout. This is where each person in the OR confirms the patient name, procedure, and site of surgery, as well as confirm the prep has been dried. It is your job to initiate this timeout. This is a crucial piece to stopping medical errors in surgery. When the timeout is completed, you will direct your attention to the paperwork and stand by to assist if instruments or materials are required by the surgeon. You will be in charge of keeping record of the supplies used as well as start and stop times of the case and all orders from the surgeon. There are 3 different pieces of paperwork that need to be filled out. Depending on the case, whether it be an anesthetic case using an anesthesiologist and an RN, or a local case where the physician only blocks the area, you will use the OR record, inventory sheet, and an orange sheet of paper where all pre, post, and discharge orders are kept. Throughout the procedure, you will need to be sure to fill out the proper times as well as keep inventory of the equipment used, such as screws, implants, as well as supplies used, such as bandaging and sponges. The OR record will have various checklists to be marked and listed by you as the circulator. You will need to ensure that you go through each heading to ensure you have filled out the sheet properly. Under the pre-op admit time, you will place the time they entered the preoperative site. This information will be given by the RN in times under anesthesia. However, in cases where local is only done, you will be in charge of marking these items. Make sure the patient has signed the consent, the op site is verified, and NPO, if applicable during a local case, is taken care of. When the patient enters the OR, this is the section marked time in, and when the physician makes his first cut or puncture, this is the incision time. Make sure before any procedure begins that you've completed a timeout and mark that piece of the orange paper. You will want to verify the patient case, operative site, and that all in attendance agree. Under prep, write the type of prep and who did it. As a circulator, it will usually be you, and confirm that the prep is dry before the case begins. During the case, look to see if any cautery is performed and to be sure the site is clear of anything during the use of such cautery. You will also need to check if the surgeon used a tourniquet. Under positioning, you will need to check if the patient was supine or on their back or prone on their stomach. Under type is where you will indicate the patient was under anesthesia or just a local block and whether it was administered by the surgeon or not. In the procedure line, write the type of procedure being performed, such as bunionectomy or ankle stabilization. If you do not know, ask your physician. When the case is complete, you will need to write the type of dressing applied by filling in the proper boxes. Be sure to note if any implants, such as screws, wires, or joint implants, are left in the body. You will need to write what type has been left and the spore test date for that item. You will need to mark the in time and the time out of the room. You will check that the patient was removed to the post-operative room. If this was an anesthesia case, the RN will be in charge of filling out the vitals and IV information in the post-op room section, but you will need to ensure that the areas regarding cold therapy instruction, post-operative, home instructions, and all CMS items are confirmed and done if it's a local case. Make sure you note how the patient left the office and with whom, and note the time at which this was done. Be sure to sign all documents. The inventory sheet is very self-explanatory. This is where you will keep track of all materials used during the procedure. Make sure you write each implant that was used as well as mark the appropriate numbers of items used on the sheet. The orange form is created for all involved in the surgical case to list specific needs for the patient. You will be in charge of the section under post-operative orders during local cases. During cases with anesthesia, the RN will take care of this section. Make sure each item is assessed and the appropriate boxes receive a check. Did you send them out to the post-op shoe or boot? What medications do they have? Go through the checklist of orders and mark the applicable boxes. Be sure to sign and have the physician sign all orders. When a case is completed and the appropriate paperwork has been completed, you will then focus your attention back to the surgical instruments and preparing them for the next case. Be sure to exercise all universal precautions when handling soiled instruments, which includes masks, gloves, and gown. Instruments will remain on the surgical field and the edges of the field will be folded over them to cover them, at which time you will wheel the stand out of the front entrance of the OR and into the dirty nurse's station to be sterilized. All non-power instruments will be placed in a basin of detergent to be soaked, then scrubbed. All power cords and power tools will be sanitized by hand with a CaviWipe and placed ready to be sterilized. It is important that powered items and cords are not soaked. They will be ruined and rust. When items have been wiped down or soaked and scrubbed, they are to be moved to the clean nurse's station where they are ready to then be placed into the instrument container and be sterilized. While these items are being sterilized, you will then prepare for the next surgical case by placing a sterile field and prepping the patient as mentioned before. When the instruments have been sterilized, they will be ready for the following case, and each instrument set will be recycled throughout the day to ensure each case has a clean set of freshly sterilized equipment and supplies. At the end of your surgical day, you will need to ensure that each instrument set has been properly prepared, cleaned, scrubbed, and sterilized. You will also need to make sure that each case has had the proper paperwork filled out and signed by the physician. You will then turn your attention to helping the surgical scrub clean up and finish the operating room duties. As the surgical scrub technician, or scrub, your duties will be to oversee the overall cleanliness and preparation of the operating room. After you have arrived, open the office, and don the proper surgical attire, you will be in charge of opening and preparing the OR for the surgical case. Your first duty will be to mop the floors and wipe down all hard surfaces and equipment with CaviWipes. Be sure to use universal precautions when doing this, such as gloves, mask, gown, and eye protection. When the room has been cleaned, you will then place a clean sheet on the OR table and clean pillowcases on each of the 3 pillows. 3 large chucks will then be utilized, 1 at the foot of the table itself and 2 just below the foot of the table on the floor, so as to pick up any drainage that may occur during the procedure. When you have prepped the room, you will then need to draw 2 10cc syringes of local anesthetic per surgical patient. The contents of this injection will be 5 cc's of Marcaine, 0.25% plain, and 5 cc's of lidocaine, 1% plain. It is important that you check the date of each injectable medication you use to be sure they are not outdated, and use the proper drawing technique as explained in the staff training video. You will also need to be certain you have obtained the correct medicine. There are two types of Marcaine and lidocaine, plain and with epinephrine. Epinephrine is never used unless the physician specifically asks for it. So to be certain when drawing up these injectable medications, you must use plain Marcaine and plain lidocaine. After the room has been prepped, each patient will then be escorted to the room and you will take the IV bag, being careful not to pull the IV from the patient's vein. When placing patients on the table, you will need to make sure you have assessed the needs of the patient, surgeon, and procedure so you can use any positioning aids if necessary. You should ensure there are enough staff members available to help in transport and placement of the patient on the OR table. This ensures the safety of both the patient and staff. Be sure to be aware of the patient and have them covered at all times to maintain patient dignity as well as body temperature. Ask the patient to sit in the middle of the table, then to lay back so their feet are at the bottom of the table, just before they're about to hang off the end. Once properly positioned, assessments should be done to ensure all bony promises are padded and the body is in good alignment. Respiratory, circulatory, musculoskeletal, neurological, and integumentary system checks should be performed and reviewed for any signs of compromise. At any time the patient moves during the procedure, reassessment should be done. When all the materials and instruments necessary for the case are on the sterile field from the circulator, you will exit the OR to the scrub sink to prepare yourself to be gowned and gloved for the procedure. To perform a surgical scrub, you must remember that the idea is to sterilize your hands as well as possible before placing a sterile gown and gloves on. As such, you will need to ensure you are in proper surgical attire. Clean surgical scrubs, surgical cap, surgical mask, shoe covers, and surgical protective eyewear. You need to adjust all items to be comfortable because as soon as you begin the scrub, you may not touch anything. You may not adjust or fix your mask, hat, or eyewear. So it is important that those things are in the proper, secure place before you begin the scrub. Many people choose to place a piece of tape on the face mask over the bridge of the nose to keep their breath from steaming up the glasses. The first time you do a surgical scrub, you'll need to ensure that jewelry is removed from your hands and arms, and your nails are free from artificial nails or polish and trimmed neatly. You'll need to perform a 5-minute scrub for the first scrub using a iodophor providine or chlorhexidine scrub brush. Additional scrubs may be done with the Septisol foam for 30 seconds. Within the scrub brush is a nail cleaner. You'll run the water in a steady stream, warm to hot, but not too hot to stand, and wet your hands. Use the nail cleaner to clean under each nail of all fingers, ensuring no dirt or material is trapped in your fingernails. You will then take hold of the scrub brush and, using the water, work the brush into a lather. You will then proceed to scrub your fingernails on each hand for a count of 20 at each nail. You may scrub multiple nails at the same time. When the nails have been scrubbed to the count of 20 for each nail, you will then move to each finger. You must treat each finger as if there are 4 surfaces, and you will scrub each surface with the brush for a count of 10. When this is done, you will move to each hand. Remember to treat each hand as if there are 4 surfaces. You will scrub each surface for a count of 10 as well. You will then move to the wrists and arms, treating both as if there were 4 surfaces. Again, scrub for the count of 10 at each surface. When scrubbing your hands and arms, you'll need to make sure your hands are higher than your elbows so no dripping into your cleaned area occurs. Scrub 2 inches above the elbow. When you are complete, you will drop the scrub brush in the sink and begin with your fingers. You will run each hand and arm through the water to rinse the scrub solution from your arms and hands. Again, make sure your hands stay above your elbows so that all water runs out of your clean side and will not contaminate it. When you have thoroughly rinsed your hands, you will stand up and walk your way to the OR, keeping your hands above your elbows in front of your body, avoiding contact to any surface with them. When entering rooms, you will enter back first, or you will use your feet to kick open the doors. You will approach the sterile field and pull from the top of the gown the sterile towel without touching the gown or anything else on the table. Dry your hands and arms well, being careful to keep them in front of your body and not allowing them or the towel to brush against anything on the field or anywhere else. When your hands are dry, you will pick up the gown by grasping the gown only. It has been folded such that the surface that will be against your body is out. You will see 2 folds at either side of the gown that has been folded, and you will place each hand in one fold. With your hands in the folds, you will allow the gown to fall towards the ground, thus opening it. The folds your hands are in will open up and become the sleeves, and you will slide your arms into the sleeves, being careful not to fully extend your arms into the field or anything else. The non-sterile surgical assistant, the circulator, will then come to the back side of you and clasp the Velcro clasp at your neck, as well as tie the tie inside the right portion of your gown to shut the gown. You will then place sterile gloves on. When placing the gown on, you want your hands to remain within the sleeves until the glove is placed over your hand, so your hands will be within the sleeve. Using the hands that are inside the sleeve of the gown, you will maneuver the glove package so that you can access the gloves. They will be set up on the left and right side and folded at the top. To place the gloves on your hands, you will pick up the proper glove and place the glove to your open palm within the sleeve, being sure to place the glove fingers toward your shoulder and the thumb of the glove down. Using the hand to be gloved, you will grasp the glove placed on your open palm, and you will grab the cuff with the opposite hand within the sleeve. Then, in a smooth motion, you will pull the cuff up and over your palm to the opposite side, placing the glove on your hand. Repeat the same step using the other glove, being careful not to touch your bare skin with the hand already gloved. You will then notice a tie and paper tag on the front of your gown. You will need to take this tag, holding the end closest to the tie in one hand, and hand the other end to another person to assist you. Have them hold the card at the level you give it to them tightly. You will then spin to the left while they hold on to that tag until you've made a 360-degree turn. This has wrapped the tie around you and shut your gown from behind. You will then pull the tie from the card that the person is holding tightly and finish tying yourself up. When you have been fully gowned and gloved, you must remember that you can touch nothing that is not sterile. Even if you slightly bump along something unsterile, you have contaminated yourself and need to either place a sterile sleeve on your gown or re-gown. It is up to all in the room to ensure sterility and watch out for other members of the team. Your hands and arms should never drop below your waist or rise above your chest line. Your sterile field has already been prepped by the circulator, and now that you have donned the sterile gown and gloves, the physician will scrub in and enter the case. You will be in charge of helping him or her gown and glove. To do so, you will have him or her ground the white towel on the gown and completely dry their hands and arms. You will grab the surgical gown by the front neck corners, being sure to pull the corner around your sterile gloved fingers, because you will be close to the person's neck as you help them place the gown on. You will drop the gown toward the ground, opening up the inside surface of the gown. The surgeon will then place his or her hands in the flap at the arms, and you will help them slide the gown on. You will then open his set of gloves and take a glove, unrolling the cuff, and with both hands you will widely open the opening of the gloves, with the thumb of the glove toward the surgeon. The surgeon will slide his fingers to the edge of the cuff of the gown, or you can help them pull his gown sleeve down as he holds his hands out and up, and he will then place his hand in the glove at the same time as you pull up over his gown sleeve. It is customary to begin with the right hand when gloving. When the surgeon is gowned and gloved, you will help him or her finish the tie the way instructed above. When this is complete, you will need to prepare the sterile field around the prepped patient. After the surgical site has been prepped, you will take the plastic sterile sheet and place it under the leg, allowing the surgical assistant circulator to place the leg down on the table. You will then take an adhesive towel and pat dry the prep solution from the leg, making sure to check for any pooled solution. Place an adhesive towel around the top portion of the prep. When this is in place, you will then take the sterile extremity field off the back table. Following the instructions on the field itself, it will tell you where to put your hands. You will place the leg through the hole of the extremity pack and slide it up until you reach the sterile towel. You will then allow the sides of the field to drop around the table and pull the bottom of the drape to the bottom of the table as someone reaches under the edge of the top part and pulls the field up and over the patient. The patient is now prepped and the surgeon will begin the procedure. Generally, the physician will begin the procedure by placing an S-mark tourniquet. Some procedures do not require the use of this, however, most of the time this will be in place. The S-mark is a small rubber bandage that is used to squeeze the blood out of the veins as it is applied and then cut arterial circulation, thus making the procedure fairly blood-free. When the tourniquet is in place, he will then need his 15 blade and pickups. When passing instruments in the case, you will need to pass them properly and in the position that allows the physician to grab and use the instrument immediately. The surgeon will vocalize what he wants and then place his hand in an open palm handshake position. You will grab the desired instrument and quickly place the handle of the instrument directly and a bit forcefully in the palm of his hand and hold it there until he grabs the instrument from you. As you assist the physician more and more, you will begin to learn the procedures and know how to anticipate what the physician will need and when. Your duties as a scrub will be to pass instruments, set instruments down in an organized fashion, and be in charge of the sterile field. It is your workstation. The physician is merely visiting. You will need to be ready with gauze and sponges to help clear the area for visualization, as well as serve to retract the surgical site so they can see where he's operating. The main retractors used in our surgical center are the blunt and sharp Sen retractor. This allows you to retract the skin and tissue so the physician can see well. Your job is to place the retractors where the physician desires and stay put without moving until you are instructed by the surgeon. It can be difficult at times, and if you feel you must move, verbalize to the surgeon you need to adjust before moving. He may be in the middle of an important cut or placement. Many of the instruments used in surgery require assembly throughout the procedure, especially anything requiring the insertion of a bone screw or cut. Within the instrument pack are saw and drill kits along with their power cord, as well as the electric cautery Bovie system. When the physician is going to place a piece of hardware, he will utilize the drill set as well as the screwdriver set. The drill set must be put together in order to be operational. To do so, make sure the electrical cord is guided through the drape guides, which are in place to keep the cord from slipping off the sterile field. One end of the power cord must be passed to the circulator to plug it into the power source. The other end will be plugged into the drill power handle. When this is secure, you must place the head of the drill into the handle by following the guides at the edge of the handle and placing the head correctly into the handle. Once this locks in place, you may now place the drill bits on the head. To do so, you'll need to follow the direction of the surgeon, as he will know which size bit to use and how. When placing a bit, push the guide at the head of the drill forward. This opens a slot, allowing the bit to slide down into the top of the head. Releasing the guide will lock the bit into place. The drill will then be used to make the guide holes and prepare the bone to receive a screw, but the initial threading and then subsequent planting of the screw will be done by hand using the screwdriver. The screwdriver comes in two pieces as well, the handle and the head that holds the screw. Much like the drill, you will push the guides at the top of the handle forward and place the head of the screwdriver into the handle. Release the guide at the handle locks. This will be done for any surgical case requiring a screw. When making any bone cut, you will need to use the saw. This is powered by the same cord as the drill and is attached in the same way. You will have 3 different saw blade options. The surgeon will choose which saw blade he will use. To place the blade on the saw, you will push the button located at the head of the saw. This will open the head to show a set of teeth and grooves. The teeth will fit within the holes at the base of the blade, and when the button is released, the blade will set in place as the teeth move back into the grooves through the blade holes. During the surgical case, as the surgeon cuts into the patient's skin, they may come across certain veins that are in the way. He will utilize the use of electrocautery to keep these from bleeding as he cuts through them. In order to set up this Bovie system, again, take the power cord, whose end contains 2 plugs, thread it through the drape guides, and hand the ends to the circulator to be plugged into the power source. You will have a Bovie tip placed on your sterile field. You will need to raise the rubber blade end of this tip and cut it so only a small amount of the blade is showing through. This will be placed at the end of the Bovie head and the power will be turned on. You will be responsible to keep track of the number of sponges used during the procedure, and before the surgeon closes up, you'll need to confirm the count is good and no materials have been left in the surgical site. Your main duty as a surgical scrub is to help the flow of the procedure be fast and efficient, yet safe and sterile. This will be accomplished with proper opening, tool passing, and equipment setup technique. You will also be required to cut the tails of the suture, as well as prepare the dressing to be placed by the surgeon. When the physician has finished the procedure and closed the surgical site with suture, you will make sure he has all the materials necessary for bandaging, and he or you will bandage the patient. When the bandage is in place on the patient, and after all procedures are finished, the sterile field may be broken, and you can break out of the gown and gloves. You will need to secure a post-operative shoe or boot and place it on the patient. The patient will then be escorted to the post-operative room by either you, the anesthesiologist, or RN. When the patient has left the OR, you will need to clean and ready the room for the next case, as mentioned previously. Anytime you leave the OR, you will need to remove your shoe coverings after each case. Each garbage bag will need to be removed from the OR by exiting the south exit of the OR and placing the garbage in the dumpster in the front of the building or a trash can to the side of the exit. All soiled linens are to be placed in the yellow liner in the OR and taken to the doctor's office, where there will be a linen bag to be sent to the laundry service. You will then re-enter and place new shoe coverings over your feet for the next case. After the last case of the day, you'll need to do a final cleaning of the OR. To do so, you will find the surgical cleaning pamphlet found by the AED and crash cart, and you will find a checklist of cleaning procedures after each case. Be sure to clean all surfaces with a disinfectant, as well as mop all floors and corridors. You will then need to make sure the OR table is prepared and ready, as well as all equipment is properly shut down. This includes the air conditioning unit and the computer. There is a humidity log located on a cupboard on the east wall that must be filled out using the humidity indicator on the north wall. As you clean up at the end of the day, there is also a cleanup sheet located on the east wall that must be initialed by you, indicating that you have cleaned the operating room. You will need to be sure that all countertops are clear except for those designated items as mentioned previously. Clean out and scrub the scrub sink, and make sure all equipment and supplies are properly put away and all trash is disposed of. Be certain you leave the OR clean and ready for surgery.
By following the proper protocols and procedures, and with experience, you will be a quick and efficient surgical assistant and a key player in helping maintain a sterile, safe, and excellent surgical center. This ends our surgical assistant training video. Remember, this video was designed to give you an overall view of the operating room and a basic training of the duties you will provide within. You will find that there are many more duties and protocols that must be learned on the job. Make sure you follow the instructions of your trainer and the physicians, and be familiar with the office policies written in the operating room nurse's policy manual.